to this week's 10-Minute 2-Tip Tuesday. I'm your host, Amelia, occupational therapist, owner and founder of Higher Standards Caregiver Training. And this week, as always, on 10-Minute 2-Tip Tuesday, I have two valuable tips for you. The first is for caregivers, and the second is for caregiving organizations. Before we, do I have a reason for being in the bathroom, brushing my teeth? Absolutely. If you've ever seen 10-Minute 2-Tip Tuesday before, then you know that I do. But before we get started, let's just get one thing off the table, and that is that this is for educational purposes only. Anything that I say that reminds you of someone you know, someone you care for, someone that you work with, etc., who you think needs to be seen by a licensed healthcare provider, please make sure that you are advocating for them to be seen and treated by that appropriate provider, as this is really and truly for educational purposes only. It is not a substitute for health or medical advice or a therapeutic relationship. Okay, so you may have guessed, we're going to be talking in our first tip today about oral care. Okay, so this is actually a really simple tip. This is going to be quick. It's very straightforward. Did you know that whether or not people have teeth, it's still really important to clean their mouths? No matter how many teeth someone has left in their mouth, it's still really, really important to have good oral hygiene, right? Your mouth can be a mecca for bacteria that can get to all kinds of other places in the body. Not to mention the fact that when we develop sores or other kinds of infections inside our mouth, that can migrate to other areas. So it's really, really important that no matter what level of teeth or dentition the person that you care for has, that we're providing oral care every day. Now, the right way to do that can depend on that person. So that person's dentist might have specific guidelines or recommendations. That person's doctor might have specific guidelines and recommendations. So make sure at your next visit, you are making sure to ask those questions about what the best way is to care for that person's oral hygiene. And hey, I also understand that if you're caring for someone who is homebound, getting to that person to the dentist can be next to impossible. Like, let's just face it, let's just be honest. The traditional dentist office is not necessarily set up well to care for people who are needing physical assistance with things, or maybe who even have significant cognitive impairments. So did you know, and obviously I can't promise that this is something that's available to you everywhere, but did you know there are such things as mobile dentists? This is like a twofer. So we're saying, make sure people's oral care needs to be taken care of, but also it's kind of like a twofer. Second tip for today. There are such things as mobile dentists, and a lot of them specialize in caring for seniors or people who have disabilities where it can be really difficult to actually get into a dentist chair or into a dentist office. So look for a mobile dentist in your area and see if there's one available who can come check things out and make the right recommendations for your loved one. Tip number 2 for caregiving organizations today. So we talk a lot about training. We've talked a little bit about orientation. In one of the more recent 10-Minute 2-Tip Tuesdays, one of the questions that comes up a lot, and one of the concerns that comes up a lot of times when people are asking about training for their care organizations, is that the goal is always to hire the most experienced caregivers possible, hiring people with CNAs or PCAs, or just a caregiver who's got 10, 15, 20 years of experience under their belt. But even then, a lot of times, home care agencies, residential assisted living, anywhere that is a care organization will often have questions or concerns, or they'll see problems with everyone not following the same care standards. So the question then becomes, how do we make sure all of our caregivers are following the same care standards? And the answer to that is actually pretty simple. That is, no matter who the caregiver is, no matter what their background is, no matter how much experience they have, everyone gets trained the same way in the same things to make sure that everyone understands what that gold standard of care is in the organization. If you want to provide gold standard, gold level care, then you have to provide gold standard, gold level training, but also gold standard and gold level support for those caregivers, giving them all the tools that they need to go out and fulfill that mission, because, you know, their job is important, it can be challenging, and they need support and training just like the rest of us do. Okay, so that is it for today's 10-Minute 2-Tip Tuesday. I hope that I didn't gross anyone out with my toothbrushing. Fun fact, before I was an occupational therapist, I actually had a real problem with like saliva. It was the one thing that I couldn't handle, and of course now I could care less. Drool everywhere, drool and mucus everywhere. It doesn't matter to me anymore. Hopefully that didn't gross anyone else out. Anyways, until next time, guys, I will be back next Tuesday with 2 more super valuable tips for caregivers and care organizations. Until then, please be healthy, be well, and most of all, take care. Bye, y'all.